Now, the NHS has been forced to dramatically increase its recruitment drive amid concerns that Brexit could cause more problems for recruiting nurses, already suffering from dwindling numbers. The hope is a big publicity push can encourage new people into the profession, while thousands of EU staff working in the UK await clarity about their residency status. Our West of England correspondent Rebecca Williams reports now from Bridport in Dorset.
There are constant pressures on the NHS, and one of those pressures is recruiting and retaining enough staff. It's an issue they're experiencing here in Dorset, where they're desperate for more nurses.
The rest of the staff here are trying to do extra shifts where able. We're short-staffed, to run short-staffed sometimes, and although we try to give our patients a level of care that we like to meet to, but it's not always possible.
Figures released today show there was an increase last year in the number of job adverts placed on the NHS website. For example, in September 2016, there were around 2,500 more adverts placed than in the same month the previous year. Here at Bridport Hospital, around 90% of patients are pensioners, and that brings challenges as they try to free up beds. They're now so desperate for nurses that they've launched a big advertising campaign. These pictures are on the London Underground to try and attract people from big cities.
It puts us under a huge pressure because it means that we're not able to develop the services in the way that we'd like to, as quickly as we'd like to, for the local population. And we have been recruiting locally for some time, and what we'd like to do now is to really widen our nets and encourage people from inner cities to consider a life change, and we will support them through this opportunity.
And patients are also only too aware of the demands on staff. And they're under pressure, are they?
Yes, I would say they are. I mean, sometimes it's just one person looking after you, but they have to go and get another one because the patient is too heavy to do on their own.
Some NHS trusts have in the past recruited staff from abroad. Mako Fernandez-Caro is one of those. Originally from Spain, she now works in Manchester, but's worried about the implications of Brexit.
We could be illegal in this country the day after Article 50 is triggered. And it's not nice not knowing what's going to happen to me, because I want to plan my future. I want to know where I'm going to be living at least in 2 years' time.
From paramedics to midwives and nurses, experts warn the NHS is in need of thousands more healthcare professionals. And with an ageing population, this is an industry experiencing unprecedented problems. Rebecca Williams, Sky News, Dorset.